It strikes people of all ages and all races. It is the second leading cause of death in the United States and Canada. Cancer. This year alone, it is estimated that 1.5 million new cases will be diagnosed, and statistics indicate that it will claim the lives of more than 500,000 Americans.
Incidence of cancer is rising significantly. It is true that we are curing more patients with cancer, but mortality and the cause of death remains elevated and is rated second after cardiovascular disease.
Dr. Fareed Fatah is a leading authority in the treatment of cancer in the U.S. and has saved the lives of hundreds of patients. Many of them travel from Canada to the U.S. for treatment. The saturation of the Canadian health system sometimes makes it impossible for patients to receive adequate care.
People looking for MRIs or CT scans, CAT scans. If they're not in the hospital, under hospital care, if this is something from an outside situation, they're looking at months for a diagnostics test. Waiting for healthcare is not the answer. Waiting for healthcare makes the problem worse, not better. And if you're dealing with certain situations, waiting can be a real problem. If we're talking about cancer, we could be talking about life or death.
But it's a prior approval type of thing. Really what I'm saying is you gotta get approved before you take treatment. Well, in my case, I had 2 days to live, so how the hell, especially on a long weekend, an Easter weekend, how can you send an application in and see anybody at all?
With life expectancy at about 73 years and the baby boom generation reaching retirement age, the healthcare system is already beginning to feel the effects. In the U.S., healthcare reform is underway, but many experts say it is still too early to tell if the changes can keep up with the demands of a growing, aging population.
So as the healthcare need is growing at a rapid rate, the ability to service it is decreasing at a rapid rate. So today is bad, tomorrow looks much worse.
Although early detection and new treatments have increased life expectancy for cancer patients, access to adequate care is still a major concern for many.
You cannot wait on cancer. You cannot ask a patient to, initiate a workup for cancer in 3 months because you're on a waiting list. You have to be proactive in staging the cancer, working up the cancer, and initiating treatment soon.
Health systems around the world are facing challenges to cope with the growing demand for service. For many cancer patients, it is a challenge being fought against the clock. Ecumedical Resources is a new concept in healthcare that is helping patients find solutions for their medical needs. The experts at Ecumedical are able to help virtually anyone who needs the best possible healthcare now. State-of-the-art facilities equipped with the latest technology and a team of highly trained professionals give patients the peace of mind they deserve while undergoing treatment.
Our VIP service is top-notch, and we get the people to where they've got to get to quick. And we get them to the best, and we get them on the route to a cure.
With offices in Windsor, Ontario, as well as the U.S., Ecumedical is revolutionizing medical care by putting patients first. Providing a diverse range of services from cancer and cardiology care to all types of surgical procedures, Ecumedical truly offers helping hands across the border.
They saved my life.
To bring excellence in medicine and to push the boundaries, Ecumedical is expanding to ensure that patients get the best care without having to depend on someone different from their doctor to decide their treatment.
We have a great deal of support and ancillary services available to our patients. We have a psychiatrist on board, a psychology counselor, nutritionist, social services available, alternative therapies available to our patients.
We're looking that in partnerships and investment opportunities that we will be set up before the year is over in 2010 in Europe, in the Arabic states, and in South America.
For more information about Ecumedical Resources, visit ecumedical.com or call 1-866-277-9868. or MichiganCancerCenter.com or call 248 650 1090.